Hi there. The Voices team is here with a mid-session update. I'm Emily and want to let you know where we are at this point in the General Assembly session. We just finished crossover last week, and so all of the bills have been heard in one house or the other, and have moved on to the other body, either the House or Senate. Next up is we're looking at the budget on Wednesday. Chloe, tell us a little bit more about what we have to look for.
So Voices will be highlighting blogs later on this week to debrief you on where our budget amendments are. You may have been waiting at the edge of your tables for details on that. And with the crossover period, our budget conferees will be working on the budget. So look out for that early or later on this week in each of our issue areas.
And as legislative session picks back up towards the end of this week, make sure to follow Voices emails, our social media, anywhere that you can find us for our action alerts. Action alerts are where we're going to be asking members of the public to respond, to directly email or call their legislator on specific issues that need a little bit more support to get us to the end. I'm going to pass it back over to Emily to go over some of the highlights that are happening this legislative session.
Sure. So two bills we're following closely in the early childhood sector. The first is introduced by Senator McClellan, and there's a companion bill from Delegate McGuire in the House. This bill would create portable background checks for early childhood providers and provide some innovation in how we spend our childcare funds to support the true cost of quality, including higher pay for our early childhood educators. That bill we're looking at being up in the Senate side potentially on Friday and on the House side next Wednesday. So more details to come when those are coming up. The other bill we're following in early childhood is the Speaker Eileen Filler-Corn's House Bill 2206 that would expand eligibility for the Child Care Assistance Program to a higher income threshold and to include eligibility when parents are looking for work. We're excited about this opportunity to give more families financial assistance to afford childcare, and the Speaker's bill will likely be up in education and health later this week. We do have an action alert on our website that you can take action and support that legislation. I'll switch it back over to Allison to talk about foster care.
So there are a lot of issues that we're following in child welfare, but for today, I just want to highlight some of the kinship care bills that are happening this legislative session. As a reminder, when we say kinship care, we're talking about children who were referred to relatives instead of going into what some people might know as traditional foster care. So the two bills to highlight. The first one is Delegate Gudaitis' bill. We're calling it the Kin First bill. This is ensuring that when children are entering foster care or when they're older and need to be step out of foster care, that we look for relatives first. And it's really putting our philosophies and how we feel about the foster care system into law. And so that bill's making its way through, and we're looking forward to hearing that on the Senate side probably next week. The other bill that we're tracking really closely is the state-funded kinship guardianship assistance bill. This is carried by Senator Mason, who's also one of the co-chairs of the Foster Care Caucus. This bill would expand our current kinship guardianship assistance program to allow for more families to be eligible for financial assistance when they're raising their relatives through a more traditional foster care path. So both of those bills are making really great traction, and there's lots of things in the budget around kinship care. So please pay attention to that later this week when we have more on the budget. And I'm going to pass it over to Chloe to talk about some lots of things that are going on in our family economic security.
Okay, well, I'll just highlight one issue for now before I pass the mic to one of my colleagues to cover that. House Joint Resolution 537 is championed by Delegate Aird, which is to recognize racism as a public health crisis in Virginia. We've been closely tracking this piece of legislation. The resolution would prioritize steps around addressing systemic racism and the impact on the social determinants of health, charging the Virginia Department of Health's Office of Health Equity to address racism and ensure statewide policy efforts are analyzed, It looks at a category of definitions related to racism and equity, retaining the commission to examine racial equity in Virginia law, and then lastly, connecting with communities that are the most impacted by racism. We're pleased to tell you that this bill has passed the House and has been continued to the Senate Rules Committee. There is an action alert where you can sign on as an organization in support of this resolution or send an individual email to the Senate. And I'll pass the mic to my colleague, Emily Griffey, to talk about those family economic security items.
Yeah, we're watching two bills that were introduced on the House side and will be crossing over to the Senate this week. One creates what the governor put into his budget around broad-based categorical eligibility for SNAP benefits, which is a fancier way of saying that we're casting a wider net to ensure that more families can become eligible for food stamps or SNAP benefits and TANF assistance. That's a great policy that many other states, over 40 other states, take advantage of to make sure that we're not missing any families in terms of eligibility. And Delegate Dan Helmer has that bill on the House side. We're expecting that to go to the Rehab and Social Services Committee as well. The second bill is following Delegate Kathy Tran's bill that is creating an incentive program for individuals who participate in the VIEW portion of TANF, so those the work supports around TANF, and incentivizes folks to be hired in the full employment program, which is a job training or job pipeline program for folks who are participating in that VIEW aspect of TANF. So folks who might need more experience on a job site or while they're looking for jobs, this would create a financial incentive for folks to hire and place those individuals who are participating in the VIEW program, all of which who are parents. So passing things back over to Chloe to talk about some food security issues.
So around food security, we've been tracking House Bill 2065, championed by Delegate McQuinn, which is the Produce RX program. One thing to note is that if successful, and hopefully when successful, this will be the first initiative in the country where, for example, a patient could go to a qualified health provider. The patient would be within the CHIP or SNAP population, and then they could get a prescription. It's to go to the market for healthy foods. As you could imagine, we did face a funding issue because of the economic impact of COVID-19. And while Express was supported, the first year will likely just be a study to implement the Produce RX program. The bill is now in the Senate Education and Health Committee, and so we're estimating they'll likely meet Tuesday to vote on it. The last item is the paid sick leave for essential employees, championed by Delegate Guzman. It's House Bill 2137. It requires employers to provide sick leave for certain essential workers, such as law enforcement, healthcare providers, et cetera. The bill now has a provision that the act would not apply to any retail business with fewer than 25 employees. The bill is now in the Senate Commerce and Labor Committee, which will likely meet this Monday, and there is an action alert that you can take in support of this. Passing the mic back to Emily Griffey.
Sure. And so the last topics we want to check in on are children's mental health issues. Senator Dunavant has a bill, again, that's crossing over to the House that will allow schools to pull down more funding through Medicaid for school-based health and mental health services. It would ask the state to move forward with a state plan amendment to how we spend our Medicaid dollars so that schools can bill for those services outside of a child's IEP, which is what they're currently only allowed to do. So that would expand the resources that we could utilize for school-based health and mental health services and fund new ways of providing those services directly to children where they often spend most of their days, and outside of COVID times in particular, in those school settings. So we're excited to see some of these initiatives move forward. Lots of good policy progress being made this year that we're excited to see finally end this session. The end of session is now extended to the 45 days and completes on February 27th is the last day now about what we anticipate will be the last day. I should always say that, since these special sessions can go on, but we're anticipating for it to be done by the end of the month. So thank you all for your advocacy so far. We're glad to see a lot of these issues continue to move forward, and keep taking action, keep talking to your legislators, keep sharing your stories so we can continue to see all of these great changes take shape to help Virginia's children and families. Thank you.